Okay, welcome students. Mm, Today we will start uh, this session with a brief guide on history taking and physical examination. As you know, clinical practice requires skills and also the application of science. So you need to know both science and you have to also practice the skill of clinical practice in throughout your life. So you need to give attention to this important introductory part of physical examination and your techniques of history taking about your patient. So with this, let's start what is health history taking and what it needs to be for your interview techniques about your patient. So overall, your primary goal of history taking is to provide health and well-being of your patient. It is overall to improve the health and well-being of your patient. So your strategies need to be try to establish a trusting, supportive relationship with patient and to have a clear and effective communication and also, the place of interview should be comfortable to your patient. So these are important strategies that you have to follow. So to be a successful clinician, it needs was the application of science and the art. It needs the application of science and the art. So when we say it needs being a scientific, it needs you to have your background anatomic basic knowledge, your physiology basic knowledge, as well as the pathology and other pharmacologic basic sciences are needed to apply on your clinical skills. And when you say it is art, it needs a specific skill to approach to your patient. It needs specific skill for certain physical examinations to do so that you can use important recent technologies and to reach at your diagnosis and solve the problem of your patients. So uh, these mentioned five things are very important for a clinician to be adopted. The first important terminology is approachable. You have to be approachable to your patient. You have to be a listener. You have to listen to your patient, what your patient is saying, what is the main worry of your patient. You have to listen well about your patient. The other thing is you have to be self reflective. When you say self reflective, it means you have to analyze your interactions, your practices with your patient. You have to well analyze it. The other thing is it needs for you to be professional. Professionalism is very important for your career development. So in any area of your practice you have to be a well equipped professional in terms of skills and knowledge. So, having all these five things is far more important than having a handful laboratory reports and radiographic examinations. So, with this, let's see what does informed consent mean. Before you do any before you do any physical examination, before you go to any interview to your patient, you have to have consent from your patient. Informed consent is a fundamental principle of medical ethics and it requires the physician to act in the patient's best interest and respect the patient's autonomy. So both these principles are reflected in the process of informed consent. Patients are required to sign the consent forms for most of the diagnostic as well as the therapeutic procedures. It is important to have adequate communication and so that the patient can have a clear and understandable ideas. You have to have understandable, your approach should be understandable and you have to discuss the alternatives for the care and you have to explain the risks, the benefits, and likely consequences of each alternatives to your patient. Uh, let's see this standard format. This is a format which is standard sequentially put for any reporting or any recording of your patient's health history. You have to follow this standard format. This is standard format in any health history. uh, in case reporting, in reporting of your bedside patients, in reporting of your around patients, you have to follow these formats. So the first important information you have to record is information about your patient, identification. So the identification of your patient is about the name of the patient, the age of the patient, what's the sex of your patient, and the location from where the patient is. And you have to mention also the ethnicity and identity of the patient, the religion as well, whether the patient is married or not. You have to mention all these things. These are very important because there are certain disease conditions that are specifically related to certain age or sex, or sometimes geographical locations determine the epidemiologic data of certain disease conditions. The second thing that you have to mention is previous admission. You have to ask about the patient's previous history of admission, whether the admission was due to the current problem or any other problem. You have to clearly mention the previous admission and what was the outcome, what drugs were given to this patient, and what was the outcome of the admission at that time. Was the patient improved or was the patient's condition worsened? You have to mention all these things in the previous admission. The next important thing that you have to mention is chief complaint of the patient. This is very important because this is the main complaint, the main problem that the patient tells you during his or her approach, his or her presentation to the health facility. So you have to clearly write about the chief complaint of your patient, including the duration of the chief complaint. The other thing is history of present illness. You have to write what history of present illness is. We will discuss what history of present illness in the next slides. And you have to mention the past illness, the functional inequality or systemic review. You have to mention the personal and family history of the patient. And the next step is you go to the physical examination after the history is being summarized. So finally, after you do the physical examination, you have to present the summary of your evaluation. The summary of your evaluation is important. So there is subjective summary and there is objective summary. When you say the subjective summary, it is the history that you already took from your patient. So that is subjective summary. In another term, it means history, the data that's important from history. And when you say objective summary, it is your physical findings, the findings that you have got from your patient, either by looking or touching, by feeling, by different techniques of physical examination. You find a data that you call objective data. Then you go to the differential diagnosis, your investigation, the most important investigations, and finally discussion of your differential diagnosis and final diagnostic impression and final diagnosis. This is how you approach your case report or how you report your bedside during your teaching process from today and onwards. So we already mentioned what identification of the patient means. You have to write full name of the patient, the age of the patient, the sex, the address, the religion, ethnicity, occupation, marital status, source of history, and source of referral. These are very important. These are very important. So when you say age, there are specific disease conditions that can affect females specifically more than males, or there are certain specific disease conditions that can affect uh, certain age groups. For example, pediatrics age can be affected by some disease conditions. You can take, like, for example, nephrotic syndrome primarily affects pediatrics age groups. From the nephrotic syndrome specifically, minimal change disease is primarily a disease of children. And other old age, for example, you can take old age, which primarily there is certain disease conditions, like, for example, you can take ischemic heart disease, which primarily affects old age. So age is very important. The same is true for sex. So you have to well clearly write this identification data of the patient. The other is previous admission of the patient. Already we have uh, tried to mention some important clues about previous admission. You have to list the hospitalization in order they occurred. You have to specify the date and the name and the location of the hospital and the disease that led to admission and what was the outcome. You have to know the outcome of the previous admission, whether the admission is related with the current condition or is it different from the current complaint of the patient. You have to clearly mention these things. Sometimes you may need to mention previous admission history in the part of uh, history of present illness. The next step we already mentioned was chief complaint of the patient. So this is the main problem that brought the patient to the health facility. So this is the problem why the patient is uh, seeking healthcare, why the patient is coming to the physician. So you have to clearly identify the chief complaint of the patient, the symptoms which prompted the patient to seek medical advice. It should be simple, brief, and the duration should be also indicated. You have to be as precise as possible. Uh, this is also the history of present illness is also very important. In fact, this is the most important part of the history that can help you to reach your diagnosis. So to reach at your diagnosis, your history of present illness should be well elaborated, well discussed, so you can easily reach your diagnosis. You have to write the date of the onset, mode of the onset, the course, the duration, whether it was abrupt or gradual, and what was the characteristics and the location of the illness and the associated symptoms. For example, you can take cough, a patient with cough, what was the associated symptoms with the cough? Like, for example, was the patient having loss of consciousness? Was the patient having chest pain? Was the patient having loss of appetite? Any other symptoms, like associated symptoms, like others, like sweating. So you have to ask all these associated symptoms. And if the patient has took already treatment, you have to mention the effect of the treatment on the patient's symptom, and you have to also mention the negative and positive statements. When you say negative statements helps you to rule out the patient's certain diagnostic condition, and the positive statements helps you to rule in certain these conditions of the patient. So you can take, for example, a patient with chest pain. A patient with chest pain could be pneumonia. So for a patient in whom you are suspecting pneumonia, chest pain is a positive symptom because it can rule in the diagnosis of pneumonia. Other conditions that might have chest pain, also it is a positive symptom. For example, you can take patient with bronchial asthma. So patient with bronchial asthma can have a cough, but chest pain is not the characteristic of patients with bronchial asthma. So if a patient has chest pain, this is against the diagnosis of bronchial asthma. So you have to rule out with other history and physical findings. You have to rule out bronchial asthma. And you have to mention also how the patient is presented to the hospital or to the health center. Past illness. In the past illness, you have to mention history of childhood illnesses like measles, mumps, whooping cough, chickenpox, and any other adult onset illnesses that could be medical, surgical history, or other gynecologic and obstetrics history should also be mentioned. And the next important part of history is functional inquiry, or we call it systemic review. This is a detailed account of the symptoms that is referable to each system of the body. So start from the head to the toe. You have to ask all important symptoms that may support your diagnosis. So this is a very detailed part. You will read it, and for each symptoms you will learn on each body systems. So let's see the importance of functional inquiry or a review of system. So the advantage of this review of system or functional inquiry is it gives you a clear understanding of history of present illness, and it is a double check. It is a double check on the history of present illness. It permits you to group symptoms that need to be considered with history of present illness, and it guides the examiner to concentrate on specific systems during physical examination. The other important part of history is, in fact, personal history, which includes the early development of the patient, educational history, work record, any environmental history, habits, and marital status of the patient should be mentioned in the parts of personal history. So the habits in the part of personal history, habits is very important. The patient might be alcoholic, the patient might be chewing chats and smoking cigarettes. These are very important parts of history, so you have to mention also these things in the personal history. On the part of family history, you have to mention about the health condition of the father, the health condition of the mother, the siblings, and also any disease condition that may run in the family, whether the family is all are they all healthy, or is there any disease conditions in the family. If someone is died in the family, you have to ask about the cause of the death, whether the disease condition is familial or not. You have to try to elicit the cause of the death of the family member. So this is all about history. Let's see uh, introduction about the physical examination part. So physical examination, a success in recording complete physical findings depend on a step-by-step and systemic examination. So in most of the body systems, there are four cardinal methods. There are four cardinal methods. Like the first one is inspection, the other is palpation, the other is percussion, and the other is auscultation. So these four are the cardinal steps of doing physical examination in most parts of the body systems. So and the other thing is summary. Already we said what summary means. The subjective data means relevant points from your chip complaint, your history of present illness, personal, family history, and other parts of the history. You have to take the relevant and the most important parts, and from the objective data, you have to take the positive and negative pertinent findings that can support and that can rule in and that can rule out your diagnostic modalities. The next important step is your differential diagnosis list. You have to list your differential diagnoses in order of priorities from the most likely to the least likely. So when you list it from the most likely to the least likely diagnosis. But when you discuss your differential diagnoses, you do it vice versa. You start your discussion from the least likely, then you go to the most likely diagnosis of your case. So the next important is investigation. You have to send the most important investigation is that you are being led with your physical and uh, history findings. Already we said about the discussion of your diagnosis, including your most positive and negative statements. Then you reach at your final impression and diagnostic approach. So this is your physical examination steps. You start from general appearance, then you take vital signs, then you go to the HEENT, which means head, the eye, the ear, nose, and the throat parts.